This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center in Oshkosh, and if you've ever had that feeling like you're not getting enough sleep, could be a sign of something more serious. And that's what we're going to be talking about today with Doctor of Internal Medicine, Mike Duffy. Well, thank you for taking some time with us today. We want to talk a little bit about sleep problems and what are some of the more common problems people have with sleeping?
Well, insomnia is common. There's a lot of people that just have a mild form of insomnia, just difficulty falling asleep or staying asleep. It can come on at any age. There are more serious health problems that can sometimes cause insomnia, though.
Yeah, when should a person become concerned? I mean, a lot of people have trouble sleeping at night, but is it always a problem?
Well, I think people should be concerned if their sleep is affecting the quality of their life. And mostly during the daytime, if they're excessively drowsy, falling asleep inappropriately while driving or at work or in social situations where they shouldn't be drowsy, or even just when they wake up in the morning and they feel like they haven't had a good night's sleep and they can go right back to bed. Sometimes that's a sign that they're really not getting enough sleep, and it could be serious.
Yeah. You talk about insomnia. Sleep apnea is also another issue. Is that a more serious sleep issue?
Sleep apnea is probably the most serious sleep disorder people can have, and there's different kinds of sleep apnea, but the most common one is obstructive sleep apnea. And with that, what's happening is people are in bed all night and they think they're sleeping, but what happens is they never get a good night's sleep, and they're waking up frequently, or their body is waking up even though they're in bed. They're stopping breathing in the middle of the night, and they actually have a blockage in their throat, and so they're never getting a good deep sleep. They might be snoring loudly, sleeping restlessly. Sometimes spouses will say they wake up often and they're choking, stopping breathing, and then because of that, when they get up in the morning, they're just very drowsy and stay drowsy all day, and then they never get a good quality sleep, and it can affect their health. That's why it's more serious.
Yeah, and I would imagine, and people shouldn't really self-diagnose themselves whether it's insomnia or apnea, but the two are pretty different.
Right, and if someone really thinks that they might have sleep apnea or a serious sleep problem, the first thing they should just do is to go to their physician or nurse practitioner, whoever their healthcare provider is, and let them know that they think they might have that, and then they can be referred for further testing if necessary.
Mm-hmm. Sleep apnea, if left untreated, could that do quite a bit of harm?
Sleep apnea can cause serious problems because if you're not getting enough oxygen to the brain and to the heart, you certainly can get irregular heartbeats, high blood pressure. It can actually make it harder to lose weight, can make obesity worse, and it can also affect just the mental health and just work performance. People can be moody, irritable, depressed. And so sleep apnea can be serious both mentally and physically.
Yeah, if you think you might have sleep apnea, what's the best way to go about getting that taken care of?
Well, if you think you might have sleep apnea, usually what you start with is your personal physician or provider, and they may refer you to a sleep specialist, and then the sleep specialist will order a sleep study. And a sleep study is where you actually go to a medical facility and spend the night. And it's very easy to do, and the details you don't have to worry about, but they kind of hook you up and monitor you overnight, and then you're watched overnight and to make the diagnosis of sleep apnea. They actually measure the oxygen levels and see if you're not breathing during the night.
Mm-hmm. What are some of the causes of sleep apnea, and is there anything we can do to help avoid getting sleep apnea?
Well, sleep apnea is much more common in people that are overweight. That's probably the most thing that people can do is to lose weight. Things like alcohol you should minimize, and even sleeping pills can make sleep apnea worse. You have to be a little careful. But losing weight, avoiding alcohol, things also like caffeine and things like that can affect your sleep too. But by far, I think the main thing is the weight loss.
Right. And then going back to insomnia, it doesn't seem to be as serious as sleep apnea, but that can also create a lot of problems for you during the day as well.
Right, and there are people, you want to get a good sleep hygiene. It's important for people to have a good routine where they go to bed at about the same time at night and make sure the room is comfortable, it's not too hot, not too cold, and avoid doing things right before going to bed that might affect their sleep, like caffeine and nicotine and alcohol. Those things can actually make your sleep worse, and I usually tell people to do something quiet before they go to bed, like reading or just even a hot bath or something like that, and not do something stimulating. The problem with a lot of people these days is they're trying to burn the candle at both ends, and they're doing something a little too mentally strenuous at bedtime. So even computers, television, good thing to turn those off before you go to bed, and go to bed at the same time and leave yourself enough time to sleep.
Yeah. Now, what about like physical exercise? Anything like that before bed?
Well, exercise is good for you, but I wouldn't do it just before going to bed. I think that's you probably should avoid eating and exercise for a couple hours before you go to bed. I think that'd be the safest thing to do. The exercise in general is good because you want to be tired when you go to bed, but not immediately before, because then your adrenaline level's a little high.
Yeah. I think you probably get this question all the time, but it seems 8 hours of sleep is what most of us have been told. Do we need 8 hours of sleep?
Well, not everybody needs the same amount of sleep. I think that most adults probably do need 6 to 8 hours of sleep at night. Younger children and teenagers probably more. You don't have to get 8 hours of sleep, but everybody's different. And if you feel rested in the morning and you're functioning well during the day and you're not drowsy, then you're probably getting enough.
Yeah. Any other sleep disorders we should be aware of?
Well, obstructive sleep apnea is the most serious one. If you have a sleep problem and you see a physician or get a sleep study, there are other things like restless legs and jerking of legs during the night, and there's some other kinds of sleep apnea like central sleep apnea. And there are diseases like, for example, depression. You know, people that are depressed often don't sleep well. So it's good to talk to your physician about your sleep problem and why you're having a problem sleeping.
Okay. Well, we appreciate you taking some time with us today.
Okay, you're welcome.
Now, if you think you're having sleep issues, the best thing you can do is seek the advice of your primary care provider, or you can give us a call here at Aurora at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.